This is a case of stenting and angioplasty for recurrent severe internal carotid artery stenosis following endarterectomy. This is a 69-year-old female who presents with dizziness and syncope. Her neurologic examination was without abnormalities. She did have prior history of coronary artery disease and hypertension. Underwent a left carotid endarterectomy 3 years prior with velocities elevated on the left side to 700 over 300 centimeters per second. Because of prior carotid endarterectomy, she was considered to be high risk for redo endarterectomy and therefore was brought in for possible angioplasty and stenting. This is catheterization of the left common carotid with a VTEC catheter and a stiff 035 wire, and over these we are telescoping a 6 French long sheath or Cook shuttle into position into the distal common carotid artery. Once the sheath is in place, the wire and 035 wire are removed. Intracranial angiograms are performed to establish baseline, and thereafter we do a common carotid artery angiogram showing critical narrowing within the previously endarterectomized side. Because this is considered intimal hyperplasia, we cross the lesion with simply an 016 wire, and over the 016 gold tip wire we then advance a microcatheter through the stenosis. While distal filter protection can be utilized in this scenario, it's not absolutely critical as would be with atherosclerotic disease. The microcatheter is exchanged out, and now a filter is brought over the wire. In this particular case, the spider filter, which allows delivery through a previously placed oven 4 microwire. With the filter deployed, as you can see, an angioplasty to the optimal internal carotid artery diameter is performed. And then the balloon is removed. Thereafter, we bring in a stent, this being an exact stent, which is a closed cell, high radial force device. The stent is deployed across the narrowing. As you can see, it opens ideally because of the previously performed adequate angioplasty. Following positioning of the stent, we then advance a filter capture system which captures the spider filter, and then carefully the filter system is removed along with the previously placed wire. Intracranial angiograms show no change from baseline. This demonstrates a case of protected angioplasty and stenting for carotid artery recurrent stenosis following endarterectomy.